Here we go. I think that should be us just about live. I'll give it a second to boot up. Great. Okay, well, good morning, everyone. Thank you so much for joining us for this webinar session. We've got academic representatives here from the Institute of Health and Wellbeing, and we're going to be discussing 3 programs within that institute today. So we've got developing and evaluating interventions, digital health interventions, and global mental health. So we're here for you for the next half hour. We've started a wee bit late, but we'll just continue so that we get the full 30 minutes. And I've got questions here which you will have submitted as part of your registration for this webinar. But if anything comes up at all during the session, there should be a little Q&A box at the bottom. We're here to answer your questions, so don't hesitate to drop them in that Q&A box and we'll get onto them as soon as we can. So I will start with some introductions. My name's Sarah. I work in the graduate school. I'm just here to host the session, and we will get on now to introducing our academics, and then we will get started on the questions. So if I could just start with Professor Danny White.
Hi, I'm Danny White. I work in the, it's a very long title, it's a research unit called the Medical Research Council's Social and Public Health Sciences Unit, which is part of Glasgow University now. And essentially what the unit does is try to understand social influences on health and why it is that some people in the population have good health and some poor health, and how that's patterned in the population. So we're not so concerned with health services or how to cure disease, but why do people need health services in the first place? And why are there, in particular, why are there such inequalities within Britain and across the globe in patterning of health? So the research unit's made up of a lot of different disciplines, mainly social scientists. And I'm myself trained in social anthropology, so primarily qualitative research, but I've moved across the different social science disciplines and have experience with several of them. In relation to the course, the program on developing and evaluating interventions, Cindy Gray and myself developed this course. It's a very new one, and it's just run for 1 year so far. It's still at the early stage, and we're still looking to improve it all the time. And we'll welcome feedback from students on how to do that. It's got 3 core courses within it, which any students doing the program have to do. One is led by Cindy Gray, Improving Health and Society, which is primarily about developing interventions. And then the 2 that currently I'm leading are Fundamentals of Evaluation and Evaluation Design. And so those clearly are both about evaluation. The former, Fundamentals of Evaluation, is about broader issues to do with evaluation that anyone who's working as a consultant or a professional evaluator will have to deal with. The things like commissioning and budgeting and ethical issues and so on. Whereas evaluation design is very specifically about how do you design your evaluation and the different technical ways of doing that. And I'm the overall convener of the program as a whole. So my own research background is primarily around parenting interventions, both in Scotland and in East Africa. But I think I better stop and hand over to somebody else.
No, I mean, I can't speak for any of our attendees, but as someone who's worked in the graduate school since January and because of lockdown has not had a chance to meet very many people who I actually work with remotely on a day-to-day basis, I think it's really interesting to actually figure out what everyone does and where interest research is, where research interests lie. So thank you very much, Danny.
Right.
Appreciate that. Dr. Simon Bradstreet, do you mind having a little intro?
Sure. Hi, so I'm Simon Bradstreet. I'm also a member of the Institute of Health and Wellbeing. I'm personally from a mental health background. I've worked in mental health around recovery and peer support and aspects of mental health for a long time, but more recently I've been working around digital interventions and digital mental health interventions. I was involved most recently in a trial called Empower, which was testing an app intervention for people with experiences of psychosis. So the course itself comes partly from that experience and other experience in IHW and in the direct team in which I work. And it's kind of filling a gap, recognizing the increased importance of digital interventions in the health sector and more widely, and trying to offer an educational opportunity for students to meet some of the skills shortage to address that increased interest in digital approaches. So even newer than Danny's, this program's running for the first time this year, and I'm the lead on the program. I'll maybe not go into detail on what's involved in the program given our limited time. I assume some of the students have read some of this stuff. I don't know, do you want more on the program, Sarah, or is that?
I think we can move on for now, but obviously if you're watching this and you're thinking, oh no, I want to hear more about that, then get in touch via the Q&A. And I also think maybe I shouldn't say this, but I would imagine that if any student did want to get more in-depth information, it would be okay to contact yourselves.
Please do,
get that. Yeah, like we're all here to chat to you whenever you have questions. I haven't quite done it yet, but I'm about to drop the email addresses into the chat, so you should all be able to see them for each of the programs. Yeah, if anything comes up and you're thinking I'd actually like to have a more in-depth chat about that, we are here for you during the session and out with as well. So if I could move to Dr. Jimitar Karatsov.
Thank you, Sarah. Good morning, and I look forward to welcoming our new students to our Global Mental Health MSc program in November. My name is Jimitar, and I'm a graduate teaching assistant at the program. My responsibilities in the program vary. I'm a course coordinator to 2 global mental health modules, and I also assist with the feedback and assessment procedures. I supervise dissertation projects, and I also develop online teaching resources. A bit about me, I'm actually an alumnus of this program, so I can really wholeheartedly testify to the value of this MSc for my academic career progression. I have a PhD in public health and health policy, and my research interests are around mental health recovery, inequalities, and homelessness. And I also have experience in international qualitative and mixed methods research. Our program director, Dr. Julie Langen-Martin, could not be present today, but our students will have the opportunity to meet Dr. Langen-Martin during the very first week of teaching. Our academic staff here at the Institute of Health and Wellbeing really offer diverse expertise relevant to the field of global mental health, such as psychological interventions, child and adolescent mental health, recovery and inequalities, intellectual disabilities, epidemiology, suicide prevention, and many others. In terms of preparing for the new academic year, our program specializes in blended and online distance learning, and we are actually the first global mental health program to offer a fully online curriculum. And this means that we are hopefully well prepared to meet the challenges of remote teaching for our new 2021 class. And we have prepared a wealth of learning resources in various formats to support students learning for the new session.
Perfect, thank you very much. And then if we could go quickly to Amanda, do you want to do a quick intro, just let everyone know that you're the one at the end of the inboxes, which I'm about to share with everyone.
Yep, so I'm the Programme Administrator for Developing and Evaluating Interventions and Global Mental Health. And as Sarah said, I'll usually be at the end of the emails that you send. So please feel free to get in touch if you have any questions.
Perfect, thank you. So I'm just sharing those email addresses now. Hopefully if you're watching live or on demand, you'll be able to see this. But if you have any issues at all accessing the email addresses there, there's two other ways that you can get them. You can go to your program page on the University of Glasgow website, so just the main information page. There's a blue box at the top which has the email address in there, so you can go there to get this same email address to contact Amanda and then get any answers you need. Or you can just hit reply on the invitation to the webinar that you received from me, Sarah McQueen. That'll come to me and I will then field it out appropriately to whoever you're looking to speak to. Great, so thank you everyone for your introductions. We're going to have a look now at the submitted questions. And we'll just go through them in order, but where there's a question submitted to a specific program, which would probably be helpful to be answered for all programs, then we will do that. But I'll do it just in the order first of all. So this one is for developing and evaluating interventions. It says, I don't have a background in health or medicine. I work in community development and funding. What can I read or immerse myself in before starting my course to ensure I'm on a similar footing to my fellow students?
Well, thanks very much for that question. It's a really good one, but I should really allay your concerns because the courses, all the three core courses, don't presume any background understanding of public health, and the whole program is designed for anyone involved in the development or the evaluation of programs or interventions across many different sectors. So we hope that it's as relevant to environmental issues, to community development stuff, to perhaps criminal justice, reducing recidivism, a whole range of areas, different sectors, and not just public health, although a lot of our examples and some of our experience comes from public health. So in terms of background reading, I think probably the best thing would be to read Funnell and Rogers' book, which is called Purposeful Program Theory, Effective Use of Theories of Change and Logic Models. That's it's on the reading list it's the main book to recommended in developing and improving health and society. So the one of the core courses. Funnell, SC Funnell, FUNNEL, and Rogers. And I can, in fact, I'll paste that in a moment in chat.
Okay, I was just trying to spell it, so if you're going to paste it, that's good. Perfect.
I'll paste them. If you want something that's more specific to public health, then perhaps one of the I'll post in two. There's the behavior change wheel, which is very technical about designing programs and thinking through the mechanisms by which a program works, which is very much drawing on public health issues. I'll paste that in, and then a third one about unintended consequences, which again is drawing very much on public health. I'll do that now while we move on to the next question.
Perfect. And I think it might be good also to have a little rundown on how to prepare for the other programs as well. So whether you have a background or not, I'm just seeing if there's any specific questions that asked about that. Actually, there was one question that I really liked, which came from a DHI student, developing health interventions, which was about recommended podcasts as well. So are there texts, podcasts, things you can do to prepare for joining DHI?
So like the previous course, we're not expecting huge levels of subject expertise. So people, again, should allay any fears around that area. In terms of podcasts, there are a few around. There's a website called Faces of Digital, digitalhealth.com. I'll put these in the chat after. There's also a news feed called digitalhealth.net, and there's a very good organisation in England called Orca who produce a lot of briefings and blogs around digital health, but particularly from the perspective of quality. A good sort of grounding in the area and quite an accessible book which introduces some of the topics quite well around digital health, both the opportunities but also the risks of over-egging the pudding, so to speak, the risks of over-enthusiasm, is a book by a doctor called Eric Topol called The Patient Will See You Now, which is quite a famous book in digital health, which is this one. And if students are interested, there will be a reading from that at the beginning of the program, one of the courses in semester 1. But if you want to get ahead of the game, you could maybe buy that book, because it's just a really nice way it's a very accessible way to get into the subject. So I'll put all of that in the chat.
Perfect, thank you. And then same, I suppose, for global mental health. We did have a question which was about just key pre-reading, sorry, that you recommend doing, or anything that you might recommend, Jimitar, for anyone who's looking to get ahead, so to speak, or just immerse themselves in the content a little bit before you get started.
Yes, of course. So I have compiled a quick list of open access resources that our students, prospective students can engage in. They're all open access, as I mentioned, so they won't need even to have their GUIDs to access those. And that's a mix of academic papers, a TED Talk, a Guardian article, and a couple of third sector organizations resources that I think lay a good grounding for some of the themes that we're going to explore in the program. So I hope our students enjoy engaging with those resources.
That's great, thank you. And I think that actually leads me on to, sorry, are you hearing feedback, or is that just on my side? You're hearing
a little bit.
Okay.
Maybe I've just pulled this out. Oh, is that better? Anyway, I'm going to keep going. I will be transcribing this as well for the recording. So if you're thinking, oh my goodness, I can't hear, the transcript will also be coming. That leads us on to another question, I think quite well, which might actually be more for Amanda. We did have a question which was about, when do you get student IDs? When can you pick modules? Things like that. I know that there are some delays happening with student enrollment just because everything's being moved back. But I wondered if you might have anything to say about the timetable for that, and maybe reassure students that if they're having trouble with enrollment, we will sort it out before it really would become a problem.
Yep, no problem. So usually students get access to their GUID and login just shortly after they accept their unconditional offer. That doesn't always happen, so please don't worry if you haven't got yours. Just get in touch with us via the inbox for your programme and I'll look into that for you. In terms of registration and enrolment, we're around to help with enrolment. When you log in, My Campus will prompt you to enrol on certain courses, and you'll also be given a programme handbook before you start so that you can look at the programme structure and make choices about what optional courses you want to take. And like I say, any problems at all, please just email us and we'll be there to help you out with enrolment and registration.
Perfect, thank you. And just before, I can see we have had a question submitted in the Q&A, which I will get to just very shortly, because the other thing that we've had quite a lot of questions about, understandably, is the sort of blended learning approach, which we are going to be adopting for this year's cohort. I guess we might start with global mental health, because we also had a question specifically about the location for the courses, which was, I've been told by a past student that it takes place in Gartnavel Hospital, which is in Glasgow. But I haven't heard this from the uni. Is this the case, or will that be different this year? And on the same level, how much are we on campus for the course for the foreseeable?
Yeah, so lectures will be conducted remotely, and they'll be live and conducted online via Zoom and Microsoft Teams for the foreseeable future, and especially for semester 1. all our live teaching will be conducted remotely online for the foreseeable future. This includes the lectures and our newly developed series of tutorials that I can talk about briefly. In that, tutorials are different from lectures in that tutorials are designed as student-led, collaborative, and problem-focused 1-hour sessions that really will give students the opportunity to explore, discuss, debate some of the topics that have been covered by the core lectures in a really more dynamic and interactive and informal environment facilitated by a tutor. In addition to the synchronous or live face-to-face online teaching sessions, we also provide asynchronous blended and learning and online distance learning via our virtual learning environment, which students will have full access to a comprehensive body of learning resources at the very start of each week for each module, and students will be able to flexibly engage with this wealth of online resources according to their learning needs and interests as well. So the structured aspect of the teaching will be the lectures and tutorials, and the more flexible aspect will be our online resources, which will be accessed via Moodle, and they're hosted by RISE 360 Articulate, which is our virtual learning environment, and which contains reading exercises, infographics, podcasts, animations, quizzes, interviews, discussion topics, and many more types of resources.
Okay, perfect. Thank you. So I guess if we could pose the same question then for digital health interventions about on whether it be online, blended, on campus, what to expect.
Well, in semester 1, we can be definitely sure it will all be online. I guess there's some question about whether in semester 2 there might be opportunities for face-to-face meetings with students, but at very best that's going to be in very small groups with tutors. But it's very difficult to give a definitive answer. It's highly, highly unlikely there's going to be any on-campus lecturing, I would suggest, but obviously things are changing really quickly. But we're working on the assumption that everything will be online, definitely in semester 1 and probably in semester 2 as well. So in terms of our structure, I think everyone's taking slightly different approaches to delivery. What we're doing is the vast majority of our lectures will be pre-recorded. The students will then have an opportunity to watch back that recording with the lecturer present and to ask questions and to have some further discussion that would otherwise be possible. So there's a chance to watch before and a chance to watch with the lecturer. And then we also have a 1-hour seminar session for each week for each course. So in semester 1, certainly in the digital health programs, that's how they'll work. The methods one, which is shared with global mental health, is slightly different in terms of how that's delivered. So pre-recorded lecture, which you can watch back with the lecturer and ask questions, and then a seminar, which sounds a bit like your tutorials, Jimitar, in that it's more hands-on and more about student engagement and discussion. So there's more practical exercises involved in them. We will also be using Teams, MS Teams, as much as we possibly can, and so less of a focus on Moodle than there might be in other programs. And we think there's real benefits in our view around doing that in terms of accessibility and student engagement. So there's always a mechanism for students to get in touch and to have discussions on Teams, both amongst themselves and with the tutors and the lecturers as well.
Perfect. Okay, and then the same question then for Danny.
Yeah, well, almost exactly the same answer as Simon.
That's all right, yeah.
Essentially, certainly first seminar, doing it entirely online, and we're envisaging it'll probably be the same way for the second semester, but there might be some changes. We're anticipating delivering the seminars they will be pre-recorded, but we'll deliver them at a specific time and then have discussion and exercises online live each week, and the recordings will be available to students after the sessions.
Okay, so we have had a question into the Q&A, which is a topic that I wanted to cover in this session anyway, which is great. So the question is for global mental health. Is it possible to collaborate with faculty outside of your specific program for the master's dissertation? And I think this will open us onto a discussion about the project, which is obviously a massive part of the MSc for each course, I expect, but maybe we can start off by discussing the project for global mental health. Maybe start with that question of collaboration with faculty outside of the program. Jimitar?
Yes, so yes, students will have a chance to collaborate with external academic or other staff or research groups that can support their dissertation projects. Actually, in the form that we're going to send around to ask about students' plans and ideas about dissertation topics, there is a specific questions about their wish to potentially collaborate with external academics or other individuals or organizations to support their project. In all cases, though, students will also be assigned an internal supervisor, so somebody from the program or the institute as well. So in some cases, students will have more than one supervisor, but we are also keen to ensure the students have a comparable level of support, including by a member of the program or the institute that are more familiar with the nature of the projects and the standard and our policies, so that students can really get a comprehensive set of support. And as I mentioned, this can be done by more than one supervisor in some cases. I don't know if Amanda wishes to add anything about external supervisors, but I think these are the plans, these are the policies as of now.
Yep, nothing else to add to that really, but if you have any particular problems about it then, or issues, then just feel free to email us and we can put you in touch with the program lead.
And is there, when are the normal timings for this? I know one of the questions was about when you start discussion about your project, when you can start speaking to the faculty about it.
Yeah, so we encourage students to start planning their dissertation projects early in semester one, with proposals submitted to supervisors typically expected in December. Within the first few weeks of teaching, all students will be asked to complete a dissertations form, where they will be asked to indicate their preferred research area and methodology and ideas about potential external support and supervision. And this will allow students to be matched with the most appropriate member or members of the academic team.
And just before then we move on to a project discussion for the other two programs, we had a question. Do you know about the placement program for Glasgow Trauma Centre this year, Jimitar? I think that question came in through registration as well, but if you're not sure, we can.
Yes, so my understanding is that this placement has been put on hold at the moment because of the ongoing situation with COVID-19. It usually takes place, the placement usually takes place in semester 3, which is around June, July time. So at the moment, we cannot guarantee that the placement will take place. It's been put on hold at the moment, but as has been mentioned by Simon, situations changes rather rapidly. So we will need to evaluate again the feasibility of this placement in spring next year, and we will inform students accordingly.
Okay, thank you very much. Okay, so maybe we'll look at developing and evaluating interventions, Danny, for the project.
Yes, for the dissertation,
yes,
it's very similar again to
that's fine. Yeah.
to the other programs. We encourage students to start thinking about it as early as possible. We're just finalising the dissertation handbook, which will give the timetable for proposing your initial ideas and then being allocated to members of staff to act as supervisors, and again, these often the supervisors are out with the lecturers on the courses, so they can be across the whole university.
Perfect. Okay. Anything different to add or similar for you, Simon?
Yeah, ours is slightly different in that students
Okay.
will have a choice between a research project and an internship, both of which will require a dissertation output of the same length, but they're obviously slightly different focus in that one will be doing original research and the other will be more project focused. Both will require a proposal as to what the work's going to be, and there will obviously need to be evidence that that's been achieved and a description of the experience, and both will also include reports from supervisors about the students' engagement. So what we're actually asking students to do, because there is that choice, we're asking students to enroll on one of those, either one of those two courses. And the reason we're doing that is to get an initial idea of students' interest in which option they would prefer. That isn't to say it's written in stone, and it will be possible for that to be changed at a later date if necessary, if it emerges that students think, well, actually, I thought I wanted to do an internship, but actually research is what I'm more interested in. We will be able to change that, so that really our reason for asking students to express a preference really is to inform us in terms of how we match students to possible internships or research projects. But with the other, as with the other two programs, there's going to be opportunities to work both with people in the wider institute, the wider university, but also obviously with internships with wider organisations as well out with the university.
Perfect, thank you. So I think we are going to have to wrap things up very shortly. I'm aware that we've gone a little bit over, but just as sort of a finishing question, we have had a question which was about, can I join a doctoral program that starts next September? And I think this is obviously in the back of a lot of students' minds, the fact that a lot of NHS jobs, PhDs, things like that, traditionally would start in September, but with the Masters starting 2 months later, there is a little bit of concern about what the end date might look like for this. And I wondered if you had anything to comment on for that. I don't know who to go to first. I feel like Danny was nodding. Couldn't.
Yeah, I can. Well, I'm nodding because I can understand the problem.
Yeah.
It would depend a bit on where the doctoral program was, and I think if it was in Glasgow, I'm sure that our colleagues would be very understanding about any overlap between completing the masters and starting on a PhD. The main within the developing and evaluating interventions program, the outstanding thing would be completing the dissertation.
Mm-hmm.
And in an ideal world, that dissertation would actually relate to their future doctoral work. So it might actually work quite well, but it would depend very much on good communications between those running the master's program and the future supervisors of the PhD study.
Yeah. Anything else to add to that? I think the only thing I would maybe say is we aren't the only ones. Universities, in terms of universities and in terms of UK, we're definitely not the only ones who are being affected by this. Everyone is being affected by it, and I think there will be a lot of understanding when it comes to starting further study or starting another job or whatever your plans are at the end of your masters. But anything else to add to that we might not have covered? No, that's fine. Great. Okay. Well, I think we better finish up because we've gone a little bit over. But I just want to thank everyone so much for joining us today, whether you're joining us live or whether you're watching this on demand a wee bit later. And we've said already, but I think I can speak for everyone in the session anyway, that we're happy to have your emails, your queries, anything like that. If we haven't managed to get to your question or if something occurs to you later on, then you can get in touch with the email addresses in the chat box, or you can email me by replying to the registration email that you received for this session, and I will then pass it on appropriately. But yeah, thank you so much.
And
yeah,
Sarah, what
thoughts?
about that lovely question about what you had asked
I was, okay, well, I'm glad that you brought that up because I was worried in case we were out of time, but if you're okay to answer it super quickly, we had one really good question, I thought, which was, what advice would you give your younger self if you were about to start this course? So Danny, you look like you're ready to take that question on.
Well, I think one thing would be, don't hesitate to raise your issues or your questions with the lecturers. Don't hold back. Don't feel like you're asking a stupid question, because if it's bothering you, it's probably affecting other students as well. So it'll benefit all your peers as well to bring up the issue.
Definitely. Simon, you got any advice for your younger self starting this course?
God, blimey. I was hoping that we'd run out of time and I'd been able to ask the question to park the question.
Sorry.
Enjoy.
I tried to park it, but no, Danny wanted it. So
I think it's important to enjoy it,
yes.
to try and get as much out of it as possible. And the other thing I would say is, given it's online, do engage as much as possible. It's going to be really important that we work together and we understand each other's needs and that we share and we collaborate. So do get involved in discussions and every opportunity to participate.
Okay, and Dimitar?
Well, my advice would be to get to know each other, to make the most out of opportunities to collaborate with one another, get to know each other's cultures and learning styles and professional backgrounds, because that can really set a nice stage for potential future professional and other collaborations and connections post-graduation. And also, if you're passionate about a research topic, do not hesitate to contact a member of an academic staff member about your interest. Actively explore opportunities to advance your research interests. If you have strong research interests, academic members of the academic team will be very happy to support you further in your interest and potentially offer you guidance as to any work or other type of activity that you might get involved in the future.
Perfect. Thank you so much. Right, we'll leave it there for now. I feel like I'm still bringing lots of feedback to this, which isn't good. But anyway, thank you for joining us. We'll end it there, but recording will be out shortly. And like we've said, any questions, don't hesitate to get in touch. Thanks again to all of our panel, to Amanda, Danny, Simon, and Dimitar. And we hope to see you soon, whether in person or probably on a screen, but it'll be grand. Okay, thanks everyone. Bye for now.
Thank you.
Thanks, Sarah.